Hi, everyone. I'm Sandra Levy, Senior Editor of Drugstore News. Today, we're speaking with John Colaizzi, Group Vice President, Head of Enterprise Pharmacy Practice at Walgreens, and we're going to talk about the vital role of pharmacists. Hi, John. Thanks for joining us today.
Hi, Sandra. How are you?
I'm doing great. I hope you are as well.
I am. Thank you.
Terrific. So I'm excited to speak with you. So let's get started. There's really good news for pharmacists these days. The latest Gallup research shows pharmacists are the most trusted health partner. They even came in above doctors for the first time in nearly 10 years. New research from Walgreens is also showing good news that consumers' perception of pharmacists reinforces the important role they play in the communities they serve. So what are the main reasons or services that Americans are turning to and trusting their pharmacists?
Yeah, it's a great question, great place to start, and I loved seeing that data come out of Gallup. I think the first thing community pharmacists in particular provide is proximity. So roughly 90% of the U.S. population lives within 5 miles of a community pharmacy, and nearly 80% of the population lives within 5 miles of a Walgreens specifically. The second thing we provide is accessibility to healthcare. So patients visit their community pharmacist 12 times more frequently than they visit their primary care provider. And in a lot of cases, pharmacists serve as the first point of contact in the healthcare system. That's the first place that patients stop when they need some kind of a healthcare service. We provide essential services, as you know, like medication management, vaccines, health screenings. I think probably the best example of that is what happened a number of years ago when pharmacists first started immunizing. Rather than us seeing immunization simply move from provider offices to pharmacies, we actually saw an increase in immunization rates. We were able to protect the public at a greater rate because of that increased accessibility. And then fast forward to today, pharmacies actually provide the majority of adult vaccines in the US. So I think that really demonstrates our trust, our proximity, and our accessibility. Pharmacists also provide a really crucial role in managing complex healthcare conditions like diabetes, hypertension, but also complex specialty conditions like oncology and in various immunologic conditions. And our pharmacists at Walgreens manage those conditions everywhere from our traditional pharmacies to our 300 community-based specialty pharmacies, as well as at our central specialty pharmacies. So really every place where we touch a patient. And then outside of these advanced clinical services, important to keep in mind that pharmacists just offer a compassionate ear. They offer trusted advice, often forming deep relationships with our patients as part of our regular practice.
So that's great. You touched upon some of the things I was going to ask next. With respiratory viruses on the rise, a lot of primary care providers are bogged down. They can't get an appointment. So how are the local pharmacies stepping in? Pharmacists, what new services are they providing in that realm?
Yeah, and this is a good time of year to talk about that with so many people we know being sick with these either norovirus or respiratory conditions. Like we talked about, pharmacists have long been the most accessible point of care in the communities, given their proximity, their ease of access. You don't always need to schedule an appointment to see your local pharmacist. So pharmacists today are providing counseling services on OTC products to help manage symptoms, how to prevent disease through vaccines and proper hygiene. And then in terms of new services we're providing, as an example, at Walgreens, our pharmacists offer administered combination tests for COVID-19, influenza A, influenza B in nearly every state where we operate. And in a lot of states, our pharmacists can actually evaluate and prescribe antiviral medications, including Paxlovid or Tamiflu if somebody tests positive for flu or COVID-19. Then we also offer a nationwide program with pharmacist-led COVID treatment through a remote experience. So pharmacists really can be true advocates in caring for their communities, particularly during colder times like now as part of the healthcare team.
Now, that's excellent. So the Gallup survey also found something really exciting, that nearly half of adults have a, quote, go-to pharmacist that they interact with regularly. So what do you attribute this to? It is a high number, but also how can Walgreens get that number even higher?
Yeah, and I like to call those your primary care pharmacist. And most Americans have a primary care pharmacist. Pharmacists really are true pillars of their communities. Typically, they come from the communities they serve, regardless of whether they're working in a large or a small pharmacy. And today, over 60% of Americans are managing through some kind of a chronic condition. So having that face-to-face interaction, face-to-face support in your medication management is really critical to ensure adherence, improve your overall health outcomes, and also decrease healthcare costs overall. So as an example of that, payers often give us their most difficult patients to manage. So think about patients living with hypertension or diabetes or cholesterol. And we've proven that we're able to achieve for those patients 60% of adherence within a year because of those interactions that we have. To your question about how we get more people in the door, and I believe that pharmacy is the front door to healthcare, I truly believe that community pharmacy at large still remains one of healthcare's most underutilized resources. My uncle was a community pharmacist. He owned his own pharmacy out in Pittsburgh. He used to tell me that way back in the 1940s and 50s, his patients would call him doc. You know, they saw him as a resource. And since then, pharmacists have continued to evolve their role in the healthcare system. But I also think that's important in terms of why we're on a mission to continue to advance the profession by, for example, achieving provider status for our pharmacists. This recognition would not only help expand access to quality care, particularly in underserved areas, but it would also help us reduce overall healthcare costs by improving medication adherence, which we know we can do, and also just reducing the strain on the overall healthcare system, which is strained right now.
Well, that's really fantastic. And it's also a segue to my last question, which is how do pharmacists fit in with the new models of care? Everybody's talking about this now, how healthcare and pharmacy are evolving. Things are changing. So can you speak about that, please?
Yeah, a few things there. So here at Walgreens, and a lot of pharmacies have done this too, but I'm really proud about what we've done. We've made really significant progress to reduce the administrative burdens on our pharmacists and on our technicians to allow them to spend more time on patient care and on these clinical services. Our pharmacies that are supported by our central fill pharmacies and our centralized service pharmacies have a significant number of tasks like data entry, phone calls, prescription fulfillment actually removed from the pharmacy so they can spend more time in direct patient care. And we've found that these locations are actually able to administer more vaccines, complete more medication therapy management for patients and payers. In addition to that, we have our new Pharmacy First format that brings the counter more toward the front. It integrates technology such as our global scheduler, digital check-in pilot, and that helps speed up service so we can service more patients and we can service them more efficiently. But with all that, even with expanded scope and expanded technology, pharmacists are still the only healthcare providers that are not reimbursed for all of the clinical services that they provide beyond dispensing a drug. So it's really important that we come together to work with the new administration, work with Congress, work with state leaders to pursue really meaningful reform that create a more effective and integrated healthcare system that ultimately benefits patients and communities the way that they're meant to serve. I strongly believe that patients should have the freedom to choose the pharmacy and the pharmacist that best meets their needs, going back to that concept of primary care pharmacist, and also to be fairly paid and compensated for their services. If fair compensation is not achieved, then pharmacies will continue to struggle financially, and then in turn, communities in the surrounding areas could lose access to these really critical services that pharmacists provide. And the last thing I'll say too is looking at these new models of care and looking at this advocacy work that we're doing is a key component of the Walgreens Deans Advisory Council, which is now about a year old. And our group of deans and academic leaders that we pulled together have become really tremendous partners in these advocacy efforts that are underway across the industry to help move provider status forward and seek this fair compensation. They've also provided us with really extensive guidance in terms of new initiatives that we've launched, such as our patient code of conduct, which better supports our pharmacy team members, the expansion of our residency program, the creation of a new pharmacy practice fellowship program that we're building, and also programs that we're working on to better support pharmacy technicians that are interested in careers as a pharmacist so that we can continue to expand the impact that pharmacists have on the communities that we all serve.
Wow, that's fantastic. I really appreciate you sharing all these insights. It looks like there'll be more good news coming for pharmacists and for, not just the chains, but the independents as well. The whole neighborhood, community pharmacy.
I think so. We are not vertically integrated. We're not part of a PBM or a payer. So we believe that we're in lockstep with the independent pharmacies. We always say that if it's something that's good for Walgreens, it's good for pharmacy and vice versa. So we want everybody to thrive, and we'll continue to go down that path as part of our industry partnership.
Well, that's great. And we hope you'll come back and tell us more good news.
Of course, I'd be happy to.
Thanks again.